Hi everyone, welcome back to another video. This video is about my main video, which is how to access patient conditions as a pediatrician. Now in this video I'll be covering about 4 main ways to access patient conditions as my dream job, which is a pediatrician. So let's get started on the first part, which is initial assessment and observation. Now in this first step, in this first one about initial assessment and observation, we will have general observation, which is when the child's patient comes in. I will observe the child's patient's overall appearance, breathing, circulation, and other vital signs without immediate physical contact. So that is the first one, which is general observation. The next one is physical and verbal engagement. So physical and verbal engagement has to do with making the patients comfortable, especially when working in this field. I'm working with child patients, which means that they are adolescents and they are juveniles, so they're different from adults. So firstly, how to make the patient comfortable. So to create a child-friendly environment, I must get down to the child's level, so get down to the child's eye level so that I can see them clearly and have good communication skills as well. Use appropriate language for their age group, and also be friendly. Use toys, comments and books and stickers to build trust, rapport, and also ease anxiety. Also, when dealing with patients, we must be truthful, even if they are a child. Also, start a friendly conversation and use simple language so that they can understand what I'm talking about. Next is info gathering. So information gathering includes 2 parts, which is history taking and also key historical components. So history taking can involve 2 age groups, but they are both juveniles. Firstly is young children. Young children, when taking history, their medical history, I can talk to their caregiver or a parent to take history from that. And for older children or teenagers, I can take history from them directly, or have the patient parent directly there to help them assist and ease anxiety as well. So that is for history taking. This is how I will gather info. Next is some key historical components that are essential when I'm taking. So I need to take birth history, growth and development, vaccination status, allergies if they have any, family history, feeding history, past medical history, as well as social history, which means that social history means that, for example, is the home environment, etc. So that is the info gathering. Information gathering is done. Next is the physical examination. So this also includes 2 main parts, which is systematic review and also age-appropriate examination. So systematic review means that I will need to conduct a head-to-toe examination to check for symptoms across the whole body. So some basic signs to check for is temperature, if they are high or if it is low or it is just in the middle. There's also heart rate, respiratory rate, blood pressure, oxygen saturation, breathing, rash, pain, or some common symptoms which can include fever, vomiting, diarrhea, coughing, and etc. So those are some of the basic signs to check for in a child patient. So those are the things that I need to check for when there's a patient that comes in. The next one is age-appropriate examination. So this is a more thorough exam that is appropriate for the child's age or the child's gender. So this will include accessing development milestones like sexual development, because they have grown and evolved from that age group into another one, from younger children to the teenage stage. So that is the physical examination. Lastly, I want to talk about the tools and the resources that pediatricians will commonly use to access patient conditions. So EHR, they might use EHR, which is electronic health records. So electronic health records will help the physician, will help the pediatrician to access past medical records and notes from other doctors to see their past medical history. Another way to access patient conditions is through family portals. So families can email the healthcare provider, which in this case is me, and also view the lab results and inform the doctor, the pediatrician, about some of the allergies, some of the things that they need to check for. The telehealth is another way, and it is used for consultations, follow-ups, specialist consults, their advice, and also it is digitalized. So that is a good thing for families far away in the countryside or not in the urban area and not accessible to nearby hospitals. So that is for telehealth. And finally is surveys and questionnaires. So this is for complex cases, not common cases, complex cases in which the parent or provider needs to fill out a form, fill out a survey or questionnaires so that the provider or the pediatrician can further understand the patient's physical limitations. For example, their allergies or something that they cannot do. Physical limitations, functional limitations, and physical limitations. So that is for the 4 ways that I have researched about how to access patient conditions as a pediatrician. Thank you for listening for this video. That is the end of my video. And if you have any other opinions, any other things you want to add into this video, please let me know. Thank you again for listening to my video, and I hope to see you soon. Goodbye!